Emperor News is not exactly a well-known website, but when it posted a video featuring some of Barack Obama's past comments on health care, it was trumpeted by the Drudge Report, which in classic fashion boosted it into the mainstream media. But the administration, rather than ignoring the thing, decided to take on Drudge. Linda Douglas, the former journalist who now works for the White House, waded into this YouTube war with her own video. We're going to show you part of the attack video and then the White House response.
My commitment is to make sure that we've got universal health care. I would hope that we can set up a system that allows those who can't go through their employer to access a federal system or a state pool of some sort. There's going to be potentially some transition process. I can envision a decade out or 15 years out or 20 years out.
Hi, I'm Linda Douglas. I'm the Communications Director for the White House Office of Health Reform. And one of my jobs is to keep track of all the disinformation that's out there about health insurance reform. And there are a lot of very deceiving headlines out there right now, such as this one. Take a look at this one. This one says, uncovered video. Obama explains how his health care plan will eliminate private insurance.
And joining us now to talk about the White House media strategy is Linda Douglas. Welcome. Why did you decide to take on Matt Drudge and put up that video, which of course calls more attention to the original attack video?
Well, you know, one of the things we learned during the campaign was that if you give people all the facts, they become better informed. You know, there were all kinds of myths and smears that were used against then Senator Obama during the campaign. What we discovered is if we countered them with the real facts, people really paid attention. They understand what the truth is when they seek it. And in this case, this was, you know, a bunch of clips that were taken out of context with a headline that said, the president wants to eliminate private insurance. Well, that is the absolute opposite of what he's talking about.
Well, hold on.
Doing.
When you say taken out of context, that video featured clips of Barack Obama before he was president. The dates were given. He was talking about health care. It's his own words. How is that illegitimate?
Well, as you know, you can take a soundbite here and a soundbite there. They took pieces of sound bites from different periods of time. They put a chyron, that's the words on the screen, that said wants to eliminate private insurance to go along with these sound bites that they cobbled together. And our point is that he's saying exactly the opposite. The health insurance reform that we're talking about is built upon the current private insurance system. That's what it is.
Right.
So we felt it was important to stop that in the track.
It is not his current plan. And so you can say, well, misrepresented or perhaps suggested that this is his position now. But apparently he had a different position when he was a senator, and that's legitimate.
He didn't have a different position when he was a senator. But the point is the president of the United States...
What do you mean he didn't have a different position? He talked about, first he talked about single payer, supporting that was years ago, and then he talked about making a transition over 10 or 15 years to fully government insurance.
What he talked about early on was, look, if he could start all over again, maybe it would be fine to have a single-payer system, but we're not going to start all over again. Okay. There's legislation that is being written in Congress that will become the law that he signed. That is legislation that is built upon the private insurance system. If you like the coverage you have at work, you can absolutely keep it. It doesn't change except you're protected from onerous insurance regulations. So that's the legislation that's going through Congress, and that's what he's promoting as president.
The woman behind this Naked Emperor website is Pam Key. She's a 42-year-old California mother and a children's book illustrator who has this very anti-Obama site. She's not affiliated with any larger political group. Well, doesn't she have the right to speak out?
Of course she does, and we have the right to correct the information. You know, one of the things we're going to be doing this week is making available a website where people can go to get the facts about health insurance reform. There's a lot of misinformation, and there is, as I said in the video, a lot of disinformation. That's information that's meant to mislead you. So we're going to have a new site where people can go, they can get the facts, they can share it with family and friends, they can look at some videos, we're going to have some fact sheets, and we're going to make it possible for people to get the answers to the questions that they're seeking.
Okay, well, I'm still skeptical on whether using someone's actual words is disinformation, but another thing that the White House did in recent days that has drawn some flack, particularly on the right, is to ask people in this effort by you to collect what you would call disinformation, to send in emails of those who perhaps are not representing adequately the president's health care plan. That was talked about on a number of programs, including the O'Reilly Factor. As Bernie Goldberg, Bill O'Reilly, talking about this effort.
I'm really glad that you used the word hypocrisy, because that's what runs through all of this. Yesterday, somebody in the Obama administration, Linda Douglas, who I know and I think you know,
yes,
said that if you have any fishy, her word, fishy information, misleading information about Obama's health care plan, send it to us at the White House.
He went on to say that if the Bush administration had tried this, it would be a page-one scandal story in the New York Times.
Well, as I said before, there's a tremendous amount of misinformation, disinformation, myths, rumors that are being circulated all over the place for people who are trying to scare. This happens every time you try to do something with the healthcare system. There's tons of special interests who have a vested interest in keeping things the way they are. So there's a lot of effort to scare people. And what we've asked people to do is, if they're worried about something they've heard, send in the information. We don't have a list. We're not keeping any of the sources of information. I mean, those are all crazy
well, you're not
charges.
Keeping it. So, why is it crazy? Republican Senator John Cornyn has asked the White House to stop this, and he says this could raise the specter of a data collection program.
But we're not covered. There's no list being compiled. The information's not being retained. The sources are not being tracked. But if there's a rumor going around, as there have been many rumors of going around, we say, let's take a look at the rumor and see what the truth is. And so the information, you know, is all around and examined and looked at, and we provide the truth for people on a website that I think they're going to find very helpful as they try to get the truth about health insurance reform.
By the way, what did you make of Rush Limbaugh saying that the healthcare logo of the administration resembles a Nazi swastika?
I just don't even know what to say about something like that. I mean, you know, people are saying crazy things right now. You know, here's the thing. Americans are suffering under the rising costs of health care. They are paying 30% more out of pocket than they did. It's threatening their jobs. They are being denied insurance coverage by all these crazy rules. And so trying to discuss that in a civil way right now is extremely important for people's lives.
You were a journalist for 3 decades. You worked for ABC, you worked for CBS, National Journal. You were a guest on this program many times. Is it at all uncomfortable to be pushing an administration line on health care on people who are your former colleagues?
Absolutely. Pushing an administration line, you mean trying to promote, trying to advocate on behalf of health insurance reform is a very gratifying thing to do. This is the country's greatest need. They've been waiting for decades for their government to act.
But if you were still a journalist, you'd be sitting in this seat, you'd be asking many of the same questions that I am. Instead, you're a saleswoman. You have to sell the president's plan, right?
Well, it's something that all of us in the administration believe in deeply. I mean, as it happens, I, as a journalist, covered the last effort to try to bring health insurance reform to the country. And I saw how the special interests just crushed the effort, and people now have seen their insurance premiums double over the last 10 years since there's been no inaction.
You had a long-standing interest
so
in this.
I had a long-standing interest in this. I feel very privileged to be able to work on this.
13 journalists by one count have now joined the Obama administration. Jill Zuckman, formerly Chicago Tribune, was one of them. She was a guest in this program. So some people are saying, well, you were all a bunch of closet liberals just waiting for a Democratic administration so you could cross over.
Well, as you know, Howie, because we've known each other a long time, I retired from ABC News back at the end of 05, and I joined the Obama campaign last year because I wanted to be an advocate for his candidacy, and I'm, as I say, privileged to be able to help with this effort in his presidency. And it's a different stage in life, it's a different career, but I'm really gratified to be able to do it.
And we're gratified to be able to have you. Linda Douglas, thanks very much for stopping by this morning.
Thank you.
We appreciate it.